Hey, it's Jessica DaMassa with WTF Health. I am here with Chris Kommatas. He is the chapter head for Health 2.0 in Melbourne, Australia, and he is also the head of innovation for Innovation Roundtable. So welcome, Chris. It's good to have you here from down under.
Well, thank you. It's great to be in Santa Clara. Good to be back home.
That's right, you are from here.
Yes, I'm a New Yorker myself, but I've been living in Australia for 8 years.
And you're developing an accent, I've heard every once in a while. So give us a sense of what's going on in the health innovation space in Australia. What's happening? Give us a state of play right now.
Yeah, it's a very exciting time in Australia about health innovation. We have many government-driven or government-run opportunities within Australia for entrepreneurs and clinicians alike that are really interested in health innovation. There's lots of money being put into it, lots of focus, lots of activities and events that are making it a very exciting space to be in Australia at the moment.
Okay, so the money that's coming in, is it mostly from the government?
Yes, we are a single-payer health system in Australia, so the government provides all the funding for healthcare. There is a private insurance opt-in that you can take, and most Australians do take that up, but most of the funding is coming from the government.
Okay, and give us a sense of what some of the big health challenges are in Australia. I mean, here we talk a lot about improving basically like systems and processes in hospitals, like interoperability and making better use of data. We talk a lot about improving health outcomes, especially with chronic conditions. Right now, the opioid epidemic is pretty hot here. So what's going on in Australia? Give me some of the things that people are working on.
Yeah, well, very similar to what's happening here in the U.S. I think we're probably about 5 to 7 years behind in terms of our shift into value-based care versus activity-based care. So we're still reimbursed on activities within our healthcare system. So that culture of innovation or that change still needs to occur in Australia, and it's happening slowly. We're starting to implement more electronic medical records into our major hospitals. There's probably around half a dozen HIMSS Level 6 hospitals now in Australia, which that's a big advancement over the last couple of years, and more coming on board. So the same challenges around interoperability, security is big. Most people aren't aware that Australia is the size of the U.S. Geography, from a geography perspective, but a tenth of the population, so 25 million. So that remote patient care, remote monitoring is really important. Telemedicine, remote care, to be able to manage people away from the big tertiary centers and making it more convenient for them.
And then what's the startup community like? Are there a lot of healthcare startups out there?
Australia was in the top 20 in terms of startup ecosystems. I think Melbourne, in particular, where I live, is probably one of the top 5 in the world for health technology and medical research. So we like ourselves to Boston. It's not that far of a stretch. We have a really high concentration and density of PhD students, researchers, clinicians, and entrepreneurs all kind of merging together within a hub, and it's leading to a lot of activity and a lot of excitement.
Okay, is there a particular strength that you feel like Australian startups bring to the table? So, I mean, we talk, different innovation communities around the world have kind of, they've got like a little reputation, that starts to emerge. And so people will say like, oh, in the Nordics, they're very focused on design, but they're also very good at mobile because of their history, Nokia and things like that. So what about Australia? What's Australia's superpower when it comes to healthcare innovation?
Oh, I like that, superpower. Superpower, I think, would be around engineering electronics, especially around bionics. We have a really strong bionics program, bionic eyes, bionic ears. Cochlear, obviously one of Australian startups, was really renowned around bionics. So I do think that they have a really strength in universities around engineering. And then medical research. We punch way above our weight in medical research. We are probably top 5 in the world with only 25 million population in terms of delivering medical research around peer-reviewed papers and all that. So really strong research and really strong around the engineering side.
And I know, for other business, not necessarily healthcare, Australia is often seen as a jumping off point to Asia. So would you say the same thing about healthcare? Is Australia a jumping off point into the Asian markets like Singapore or even like with China and things like that are like, basically compared to here, they're right there. Would you think it's a jumping off point?
Yeah, I think being in the same region within the same time zones, we have a very good relationship with Asia, especially the Chinese market. Australia represents a really strong and robust educational sector. So many Chinese students come to Australia to do their education instead of going to the US or into Europe. So we have a very strong Asian population. That leads us to have very strong ties with lots of the provinces in China. So we do a lot of work around healthcare in China. It is a great kind of launch pad or springboard into Asia because we have a very good legal system. Protecting IP is very important. Also, we speak the same language, so navigating that, or sort of the same language. So navigating that process makes it a lot easier. The Australian government, both on the local and federal level have been very receptive to startups coming over. There's lots of incentives and grant programs for startups that want to come over into Australia, with potentially the final destination being somewhere else, but we can definitely be that test bed, for lack of a better word, for healthcare startups that want to explore the region.
Okay, and speaking of testbed, I mean, I know personally what you do, and I'd like to give you an opportunity to talk about that. So with Health Innovation Roundtable, or is it just Health Roundtable? I'm sorry.
Health Roundtable.
The Health Roundtable. I'm sorry. I knew as soon as I said it, I was wrong. So the Health Roundtable. I know what you guys have done, and I thought this was a really cool model, is to try to help bring innovation into hospital systems, individual hospitals, and you're leveraging knowledge, right, that you're learning from implementing an innovation in one place, and then taking that and kind of sharing that wealth of information and how things worked and what didn't work, and then replicating in other places. So talk a little bit more about that. How did you develop this model? What are you hoping to achieve?
Yeah, the Health Roundtable is an absolute unique organization. For the last 25 years, we've captured inpatient episode data for roughly 300 hospitals across Australia and all of New Zealand. So we capture probably around 80% of the hospital activity throughout the entire country and all of New Zealand. What we do is we provide a benchmark. So we can actually look at quality and safety across hospitals and have them be very transparent in terms of who's performing well, who is struggling a bit or challenged within certain clinical areas and operational areas, and then have them and have an environment where we can bring them together and actually collaborate and share insights in a very safe manner, that they don't feel that they are at risk for looking foolish, I guess. So at the end of the day, it's a fantastic membership-based organization. We're non-for-profit, we're for hospitals and by hospitals, and we really help drive that culture of innovation within the healthcare systems. What we're trying to do now is trying to scale innovation and trying to create an access point where startups that are interested in coming into the Australian market especially, we can clinically validate within the healthcare system, find the right hospitals that have that challenge or that problem. I heard Matt just say in a session, what problem are you solving? We absolutely make sure that those startups, we identify the problem they're solving and the hospitals that need that problem solved.
I mean, that's one of the biggest challenges. And I think, especially here in the U.S., we hear a lot of startups that are like, I cannot find my way to the right person in the right hospital to actually give them even a glimpse at what I've provided as a solution. So, in this market, what you're testing, do you think it could be replicated in a market like the U.S.?
I think it is. I think there are organizations that do that in the U.S. It's probably at a much larger scale when you take in things like supply chain and the payers in the U.S. that are more complicated than Australia. Again, because we are a single payer system, it's a bit easier. We focus just on the clinical outcomes and operational outcomes in hospitals. But I do think that there are subsets within the states that we're absolutely looking at and we're investigating right now. I think our main focus is trying to bring more U.S. companies into Australia to really take advantage, as I said before, about the medical research, the really tight focused markets that we have. We can actually pull a really strong segment for any of the startups that want to come over. And then again, having that kind of springboard into the Asian markets if required.
All right, last thing for you. I'm going to let you sell the benefit of a U.S. company going into Australia, because a lot of people will say their biggest I guess, rebuttal to that would be like, well, why would I go into such a small market?
Yes.
So why would they go into such a small market, Chris?
So many reasons. First of all, I'll do the obvious. The conversion from U.S. dollar to Australian dollar right now is extremely strong. The U.S. dollar is extremely strong. You get a lot of value for a dollar in Australia, opening up a business. There are many government-based tax incentives and business incentives to come into Australia. Australia has always been ranked one of the top 5 places in the world to live, especially Melbourne and Sydney.
I was going to say, isn't Melbourne voted the most livable city year after year, 3 years running?
I think this year we got beat out by Vienna, but I think we're number 2 now, especially in Melbourne, where I live. So yeah, it's a fantastic place to start a business or to kind of grow your business. In that it's not a hyper-competitive environment. You have lots of people that want to engage, that want to help you, that are willing to look at favorable business terms. With most organizations. And like I said again, I think we've got just the right amount of distance from the U.S. market into Asia. That 14-hour flight is not so bad from LA if you kind of just put on your movies. Have a good meal, and that flight will go by really quickly.
Yeah, it helps if you're in Qantas business class, right? Well, Chris, thank you so much for joining us and for talking to us about the Aussie market. It's so good to hear about what's going on down there and hear about the innovations you guys are bringing into the health system. And I really appreciate your honesty too, because some of that, you were honest, and I appreciate that.
Well, great.
Good. It was good to talk to you.
You too.
We'll catch up with you soon. Maybe we'll catch up with you in Melbourne.
Okay.
I'd love that.
Sounds great. Thank
I'm
you.
Jessica DaMassa with WTF Health here at Health 2.0. Thanks so much for joining us.